let's talk about this lifestyle modification, exercise, nutrition, sleep and stress management piece. What are the key factors there that you're helping them with and advising them on, and maybe even holding them accountable to during this time?
Yeah, so let's start with the nutrition piece, because I always love to talk about food. So for my patients, I always try to make it simple. There's so much information out there around nutrition. There's paleo and there's keto and there's the autoimmune paleo, and there's all these things, and people get really overwhelmed with all the information. And I'm like, dude, I just need you to eat a half a plate of veggies. Let's make this simple.
Right.
So
just put some green stuff on the plate there, huh?
Yeah. I need you to eat some protein and drop all the white flour for a moment. And so, I teach my patients how to make a plate. And, general rule of thumb, and I'll modify it a little bit for everybody, but general rule of thumb is I want you to eat half a plate of veggies. I want some protein on there, and how much protein you need depends on if you're male or female, if you're working out, strength training, all of that. A little bit of starchy carbohydrate, because people are afraid of carbohydrates, but they shouldn't be as long as they're doing the right things. And then some fat. And I tell them, that's your general plate. Stop making it so complicated and just focus on those little things. Now, if they do have Hashimoto's, the other piece that we really have to pay attention to is gut health. Right. A lot of them have, leaky gut or increased intestinal permeability. So then we have to look at possibly some food sensitivities. Namely gluten is a huge one, and I would say dairy is another big one. There's other ones like soy, and there might be other nuances there. For some people, nightshades are problematic. Sometimes we have to do a protocol that actually helps heal up those barriers in the intestine. So that's kind of an added step for people who have Hashimoto's, but I just need to get them doing the basics and to eat on a regular basis.
Yeah, but let's be honest. I mean, the plate you just described, whether you've got Hashimoto's or not, you've got gut health issues, is you're eating in the right pathway. There might be some adjustments of little things that you don't do, like when you pick in the starchy carbs, maybe we're not using wheat, right? But,
right.
We're picking another starchy carb, but the plate looks the same. At the end of the day, it doesn't really change. Fascinating that this isn't more well understood, but okay. So the nutrition piece, keep it simple, stupid, and at the same time, there is no one size fits all. So find the things of the food combinations that work best for you. Just try to work inside this framework, right? Great nutrition advice for your general well-being, and anybody that might have a potential thyroid issue or think that they might have a potential thyroid issue. Let's move to the exercise piece. What advice, what information, what knowledge are you dropping with regard to moving your body more?
Yeah, so it kind of depends on what they have going on, because if somebody, let's say, has, pretty significant adrenal dysfunction or HPA axis dysfunction, their exercise regimen is going to look a lot different from somebody who's relatively healthy and doesn't have that going on, because those folks need to kind of tame things down a little bit. Doing a HIIT exercise 6 days a week is not going to serve them well. So kind of depends, but in general, what I find people struggle with the most is not lifting weights, not throwing around heavy stuff, right? Especially women, right? It's all about the cardio, all about being on that treadmill or that elliptical for hours and hours and hours. And I'm like, y'all, you need to work on those muscles, because having muscles is really important for thyroid function. It's important for converting into active T3. And thyroid, another piece I didn't mention, is thyroid impacts bone health. And then as women, as we get older, like you mentioned, estrogen declines, we're at higher risk for osteopenia and osteoporosis. I'm like, if you guys don't want to be on these nasty meds for osteopenia and osteoporosis, you got to start strength training. And so where we start them at just depends. Sometimes I'm like, listen, just sit while you're watching TV, do some resistance bands, get started there. And do it consistently every single day, or 5 days a week, whatever it might be. And then we just build from there. A lot of people want to do, they'll do like 1 hour a week, and they're like, all right, I'm tapped out. That's all I'm doing. And I always tell them, I'd rather do 15 minutes 5 days a week than do 1 hour 1 day a week, because I need you to create a habit. I need you to create a pattern so that we can build on that moving forward.
Yeah, I love that advice. I mean, obviously you're speaking my language, with regard to the resistance training piece and the exercise protocol with regard to the specificity of what a person needs or what their current health status and previous health history may or may not have been, And you mentioned something right off the bat there. I love how you cued in on that right away, and that is sometimes they need to exercise less. Or, when we say less, it's more as less is more. It's less intensity. It doesn't necessarily mean less frequency. It doesn't mean, that it doesn't even mean less time. It just means maybe less intensity, because that, going back to the hormonal, web, right? The sticky web that we often have to untangle, that cortisol response, if you've chronically been stimulating that cortisol in a potentially negatively impactful way, could be a prime reason why your thyroid isn't functioning correctly. And so you have to dial it back versus, many people just need to maybe move more. And it starts with, you mentioned bands. It's a walk outside. Get your walk and your vitamin D, your natural vitamin D, those kinds of things. So again, it's a general approach. It's not stop eating. It's not go to the doctor, find out you have diabetes, stop eating carbs and start exercising, do your cardio, which it makes me angry. Like I steam when I hear my doctor, I just came, I need an exercise program. My doctor said I need to go keto or I need to stop eating carbohydrate. At least that's what they heard. I need to go keto. And, I'm supposed to do cardio. So I want to get into your cardio class, which by the way, we don't offer here. We don't have a strictly cardio class.